Dr. R.V. Jayakumar, working as Senior Consultant Endocrinologist at Aster Medicity, Cochin. I have been invited to give a talk on secondary diabetes, when to suspect, by the RSSDI organizing committee, and I am very thankful to them for inviting me. Coming to this topic of secondary diabetes, when to suspect. See, diabetes as a whole is a main non-communicable disease problem now, taking the attention of all over the medical field. And out of it, if you look at the diabetes, about 90 to 92% will be type 2 diabetes. But it is people are always after this diabetes, type 2 diabetes. But remember that there is a small group of diabetes called secondary diabetes. Diabetes secondary to many causes like endocrine cause, pancreatic disease cause, genetic cause, drugs, and all those things. And the importance is it contributes only around 5 to 8% of the total diabetic population. But the importance is that if you make out this, if you must take all your trouble to make out this, because if you remove the cause for the secondary cause, the patient will be free of diabetes in the rest of the life. So the main thing is only endocrinopathies, that these hormonal diseases producing excess of growth hormone like acromegaly, or excess of cortisol like Cushing syndrome or pheochromocytoma. If you suspect this disease and make a diagnosis and confirm it, you can remove the basic endocrine pathology and the diabetes secondary will disappear. Like that, pancreatic diseases. If you pancreas is the home town of insulin producing beta cells, and if there is any damage to the pancreas, it is natural that you will get diabetes. So if we can make out that one, you will be able to treat the patient like comfortably. Like that, diabetes secondary to drugs. If you are able to detect the drugs and remove the drug from the patient's therapeutic arena, the patient will be free of that diabetes. And lastly, there is a good order of genetic conditions like MODY and all, which can produce diabetes. If you make a diagnosis of it, the advantage is that many of them can be treated with a small drugs which are ideal for the genetic defect. So I think when to suspect it is a clinical examination, history taking examination, and physical examination, because some of the endocrine causes are, if you suspect it, it is easy to pick up and make a diagnosis and confirm it, like Cushing syndrome, acromegaly, and all those things. So the main message is that all the diabetic patients should not be dumped as type 2 diabetes and continue to treat. You must look for a secondary cause, even though it can constitute only a minority, so that if you can make a diagnosis, you will be able to save the the patient from the diabetes. And at the end, let me thank the organizers RSSDI for arranging this program and inviting me to give a talk for this. And I thank everybody, including Dr. Benji Sabu, for arranging this program. Thank you.